Hi there, I'm Tyler Stewart. I'm a medical oncologist at UCSD, and we did a pilot study looking at urine tumor DNA in patients with suspicious bladder lesions. We took patients who had suspicious bladder lesions who were coming into the urology department, either with a new concerning lesion or were being followed for recurrence disease, and we did urine tumor DNA on them. We used a methylation approach, and what we did is we had 37 patients who were concerned for bladder lesions. Of those, 26 of those patients actually had cancer. We also had a control cohort. What we measured was a urine tumor allele fraction estimate. And in patients who had non-cancer, these are our control cohorts, they all appeared to have significantly less tumor allele fractions. This is not a pre-specified cutoff, but a cutoff using a control cohort from another population. In the patients who had a suspicious cancer, we identified the vast majority of patients who had cancer. These all in orange. They did not have evidence of cancer, and all of these patients who did have cancer, they all had very high tumor allele frequency.
Well, this group?
And this group is the patients who had concern for recurrent disease. And we found all of the high-grade disease had high tumor allele fractions, and then we missed the low-grade recurrences. There are some patients where the test called it positive, but it looks like these patients on cystoscopy didn't have disease. Whether or not if they had bladder mapping or when they have follow-up, we will identify cancer.
What's next?
We're going to use this test and we're going to look at the recurrence. So we're going to follow these patients to see if there's recurrence. We're going to do a larger study to better identify this threshold. And I really think that this test can be used to follow patients with recurrent disease, muscle invasive disease who have had excellent treatment. Bye.